Stand up right now if you're physically able to do so. I'll pause for a moment while you do that. Now, really focus and notice exactly how your body feels in this precise moment. Are you aware of any aches, any stiffness, an unusual level of tiredness, or perhaps an overall sense of heaviness? A lot of people simply brush these feelings aside, chalking them up to the natural process of getting older. But let me share something very important. Some of the most dangerous health issues don't come with dramatic, loud alarms. They arrive with quiet, subtle whispers. And one of the most serious silent warnings frequently originates in your pancreas. Hello, I'm Dr. C, and for more than 25 years, I've focused my medical practice on caring for adults who are 60 years old and beyond. Throughout all those years, one consistent truth has stood out. Although aging does bring legitimate, natural shifts in how our bodies work, it doesn't account for every single change we experience. Far too often, truly serious medical conditions disguise themselves as nothing more than typical signs of growing older. Pancreatic cancer stands out as one of the clearest and most striking examples of this pattern. Most individuals picture pancreatic cancer showing up with bold, unmistakable symptoms, such as sudden, intense pain, or obvious red flag warnings that force immediate medical attention. In truth, that's very rarely the way it actually happens. The condition usually develops in a slow, silent manner. The very first hints are typically extremely subtle ones. Unexplained weight loss that has no clear cause, mild but ongoing discomfort in the back area, minor changes in digestion, or unexpected fluctuations in blood sugar levels. On their own, each of these might appear trivial or completely ordinary. However, when two or more of them start appearing at the same time, they create a pattern that should never be ignored or downplayed. Over the course of the next roughly 20 minutes, I'm going to walk you through something I call the NERVO Protocol. This is a clear, straightforward 6-step approach that I've created, tested, and refined during my years in practice to help spot the early indicators of potential pancreatic problems. The method draws directly from reliable, well-established research coming out of leading institutions such as Johns Hopkins, the Mayo Clinic, and the Cleveland Clinic. Please understand that my intention here is not to scare anyone. My real purpose is to increase your awareness, help you see why acting at the right time makes such a big difference, and give you practical, actionable tools so you can better recognize when your body's quiet, signals genuinely deserve attention. Before moving forward, I'd like you to take just a quick second right now to leave a comment below with only your age, nothing more than that. This single piece of information helps me get a sense of who is here listening, and it lets me shape upcoming conversations in ways that provide the most useful support to the people who need it the most. As people move into their 60s, 70s, and older ages, the pancreas naturally goes through some gradual changes. The production of digestive enzymes can become a bit less efficient over time, and the way insulin works may experience slight shifts as well. These small adjustments can begin influencing appetite and body weight, long before any more noticeable or obvious symptoms show up. Think about your digestive system like a bustling kitchen that's slowly starting to run low on essential staff members. The enzymes responsible for properly breaking down fats, proteins, and carbohydrates simply aren't being released in the same quantities or with the same effectiveness. As a result, food doesn't get fully processed, and important calories along with key nutrients end up passing through the body without being absorbed. Over the span of weeks or months, this process causes a steady, unexplained drop in body weight. You may suddenly find that your clothes are hanging more loosely on you. Quite often, it's family members or close friends who notice the change before you even do. This can feel surprising or confusing. You might think to yourself that you've probably been eating smaller portions lately, or that you're simply feeling full more quickly than usual, and that's the explanation. It's entirely understandable to connect these kinds of shifts to the ordinary effects of aging. Nevertheless, any persistent, unexplained weight loss truly merits careful consideration and follow-up. In one extensive long-term study conducted at Johns Hopkins, researchers carefully followed approximately 1,500 adults who were over the age of 65. What they discovered was that individuals showing early signs of pancreatic changes experienced a loss of between 7% and 10% of their total body weight within only 6 months, even though they had made no deliberate changes to their diet or exercise habits. A weight reduction of that magnitude always signals the need for a thorough medical evaluation. Problems involving the pancreas also commonly produce discomfort, though it's seldom sharp or intense in the beginning stages. More typically, it's described as a dull, ongoing ache located in the upper part of the abdomen or straight through the middle of the back. A great many older adults naturally attribute this kind of pain to arthritis, decades of less than ideal posture, or old injuries from years past. But when a pancreatic condition is quietly developing, it can exert pressure on or irritate nerves located nearby, resulting in an ache that simply refuses to improve no matter how much rest you get, how much you stretch, or how diligently you pursue physical therapy sessions. Picture a slow, hidden leak developing behind a wall inside your house. You can't actually see where it's coming from, yet over time the accumulating moisture damages everything in its path. In much the same way, a low-level inflammation begins building up silently within the body, transmitting these faint but persistent pain messages. Research from the Mayo Clinic that tracked more than 1,200 patients revealed that 55% of them dealt with ongoing discomfort in the upper abdomen or mid-back region for as long as 6 months before eventually receiving a pancreatic cancer diagnosis. If right now you're experiencing stubborn pain in your upper abdomen or a lingering ache in the middle of your back, please type the word alert in the comments section so I can see that you're staying engaged with this discussion. Now let's move on to one of the somewhat more visible, yet still frequently subtle, warning signs. Jaundice. This shows up as a yellow tint appearing on the skin or in the whites of the eyes. You might additionally observe that your urine has become noticeably darker, or that your stools have turned unusually pale in color. Jaundice develops when the normal flow of bile gets obstructed, very often because a growing tumor is pressing against the bile duct. Imagine bile flowing like a steady, continuous river that carries vital digestive fluids. Even a partial blockage causes a backup that disrupts everything further along the line, producing yellowing of the skin, in some cases intense itching, and obvious alterations in digestion. Data from the Cleveland Clinic shows that in roughly 65% of cases involving early-stage pancreatic cancer, jaundice emerges only after several milder symptoms have already been present for some time. Whenever this particular sign becomes apparent, it serves as a powerful prompt to seek prompt medical evaluation without delay. The pancreas holds a central position in regulating insulin production and maintaining stable blood sugar levels. Whenever its normal functioning gets interrupted, the body's ability to control blood sugar can become unreliable. Among individuals over the age of 50, the appearance of newly diagnosed diabetes or a sudden, rapid worsening of diabetes that had previously been well managed can act as a significant early indicator. Insulin functions much like a key that unlocks cells, allowing glucose to enter and provide necessary energy. If the pancreas is no longer able to generate sufficient insulin, or if the insulin it produces isn't working properly, glucose builds up in the bloodstream, contributing to fatigue along with other understated effects. In a study published in Diabetes Care that monitored approximately 750 adults who had either newly developed diabetes or diabetes that was quickly becoming harder to manage, the findings indicated that around 5% of those individuals were subsequently diagnosed with early pancreatic cancer, a percentage considerably higher than what random chance would account for. This is precisely where a common error occurs. People tend to evaluate each symptom in complete isolation. Unexplained weight loss by itself, most likely just a result of aging or reduced appetite. Back pain standing alone, probably related to arthritis or posture problems. A fresh diabetes diagnosis, almost certainly tied to family history or lifestyle factors. Yet when several of these signs begin clustering together, the combined picture turns into a serious warning that calls for proper investigation. Allow me to tell you about Margaret. She was 68 years old, generally in good health, remained quite active, and enjoyed her independence. Then she started losing weight without making any effort, approximately 12 pounds over just 3 months. At the same time, she experienced a dull ache in her upper back region and found herself feeling completely full after eating only small amounts of food. When she first came to my office, she expressed genuine confusion, explaining that nothing in her daily routine had changed and wondering aloud why these things were suddenly happening to her. We immediately put the early protocol into action, beginning with detailed tracking of her symptoms, followed by timely blood tests, suitable imaging studies, and targeted nutritional guidance. Within 4 weeks, the lab results indicated elevated liver enzymes, and the imaging clearly revealed a small lesion in the pancreas. Because it was identified at an early point, she was able to undergo surgery at the most advantageous time. Afterward, she was able to regain roughly 8 pounds, and she later told me that she finally felt like her normal self once again. She expressed deep gratitude that no one had chosen to wait and see what would happen. Then there was Robert, age 72, who had successfully controlled his type 2 diabetes for 15 years without major difficulties. But over a period of 6 months, his blood sugar readings became erratic and increasingly hard to stabilize. He also began noticing pale, greasy-looking stools, along with persistent, unrelenting fatigue. He hesitated to bring these changes to his doctor's attention because he didn't want to create unnecessary worry. Once we implemented the early protocol, we moved swiftly, ordering blood work and arranging imaging that uncovered obstructive jaundice along with evidence of a small tumor. Surgery was performed, followed by careful ongoing monitoring. In time, his blood sugar levels became steady once more, the fatigue lifted considerably, and his bowel patterns returned to normal. Experiences like those of Margaret and Robert clearly demonstrate how recognizing subtle patterns at an early stage can open the door to more effective treatment options and significantly improved outcomes. Over the course of my career, I've witnessed this structured approach assist hundreds upon hundreds of patients. Now let's go through the precise steps of the early protocol that I rely on in practice. The acronym stands for Early Awareness and Response, because catching subtle patterns promptly truly has the power to transform outcomes. The protocol consists of 5 main steps, along with a 6th ongoing emphasis on sustained lifestyle support. First, carefully track the signals your body is sending. Pay close attention to any shifts in your weight, your appetite, discomfort in the abdominal area or back, levels of fatigue, the color and consistency of your stools, and, if relevant, your blood sugar readings. Maintain a straightforward journal where you note when each change began, how intense it feels, and any additional relevant details. It's the emerging patterns that matter far more than isolated symptoms. Research from the Mayo Clinic has demonstrated that consistent tracking of this kind can improve the accuracy of early detection by as much as 40%. Always bring your journal along when you visit your doctor. Be as specific as possible. For instance, say something like, "During the past 3 months, I've unintentionally lost 10 pounds. I feel overly full after eating only small meals, and I've noticed my stools have become pale." Providing precise information directs your physician toward the most appropriate diagnostic tests, whether blood work, imaging, or other evaluations. Second, take action on any modifiable risk factors within your control. While you can't alter every risk element, several meaningful changes can help. Stop smoking if that's part of your life, work toward maintaining a healthy body weight, keep alcohol consumption limited, and manage any existing diabetes as effectively as possible. Information from the Cleveland Clinic suggests that these kinds of proactive measures can reduce the likelihood of pancreatic risk progression by anywhere from 20% to 30% among those at higher risk. Focus your diet on foods rich in fiber, lean sources of protein, and healthy fats to support better digestion and more stable insulin responses. Third, ask for suitable testing whenever your symptoms provide justification. Don't hesitate to inquire about blood tests that measure liver enzymes, bilirubin levels, and, when appropriate, the tumor marker CA19-9. Imaging techniques including ultrasound, CT scans, or MRI scans offer direct visualization of the pancreas itself. Because early lesions can be quite small, persistent symptoms sometimes necessitate repeating scans at intervals to monitor for changes. Fourth, make supportive lifestyle habits a priority. Keep yourself well hydrated, choose balanced meals packed with nutrients, incorporate gentle physical movement into each day, and explore digestion-supporting options when needed. Studies in the field of gastroenterology have shown that maintaining solid nutritional intake during the early phases can enhance energy levels and help minimize complications while diagnostic work is underway. If your doctor approves, digestive enzyme supplements may assist with nutrient absorption in situations where pancreatic output has decreased. Fifth, commit yourself to comprehensive self-care on a long-term basis. Integrate good hydration practices, nutrient-dense eating patterns, light but regular activity, effective stress management techniques, and sufficient high-quality sleep. Together, these elements help build greater resilience throughout any period of evaluation or treatment. Sixth, keep up with ongoing awareness and make adjustments whenever necessary. This final element forms the true foundation. Remain attentive to your body and implement small modifications as circumstances evolve. When people follow the early protocol consistently, tangible benefits begin to appear. During the initial week, the emerging patterns start to become much clearer, and the accompanying anxiety often lessens because the process provides helpful structure. By the second week, results from tests and scheduled appointments deliver solid, concrete information. Small adjustments to diet or the addition of approved supplements can begin boosting daily energy levels. During weeks 3 and 4, those patterns transform into clear, definite actions. Referrals get arranged, digestive difficulties frequently start to improve, and overall clarity continues to grow. After the 4-week mark, the accumulated advantages become even more evident. Improved management of symptoms, the potential for earlier detection if an issue exists, and the ability to make smarter, more informed decisions for the long term. This approach is not slow or vague. It's an empowered, deliberate way to listen closely and respond thoughtfully to the early messages your body sends. To emphasize once more, the early protocol exists to promote greater awareness, encourage timely medical evaluation, and support sensible risk reduction strategies. It is not intended as a cure or a direct treatment for pancreatic cancer or for any other medical condition. Under no circumstances should you discontinue any prescribed medications without first consulting your physician. If you live with heart conditions, kidney issues, or other chronic health concerns, always speak with your doctor before implementing dietary modifications, beginning supplements, or starting new forms of exercise. Begin every change gradually and prioritize safety above all. Here's my personal challenge to each of you. Select just one single element from the early protocol, perhaps beginning a simple symptom journal, introducing one small dietary improvement, or booking a routine checkup appointment, and make a firm commitment to stick with it for a full 30 days. Afterward, come back here and share in the comments what changes or observations you noticed during that time. Your body has supported you faithfully through many decades of life. It truly deserves far more than a casual dismissal of, "It's just old age." By tuning into its quiet, subtle signals, you reclaim genuine control, the ability to act earlier, understand your situation more clearly, and keep a wider range of options available to you. Another key early indicator among seniors involves a noticeable decline in appetite, or the sensation of becoming overly full after consuming much smaller portions than you used to need. This change tends to arrive gradually and quietly. You sit down for a meal, eat only a few bites, and suddenly feel uncomfortably full or even bloated. Foods you once loved may no longer hold any appeal. Some individuals experience a mild, persistent nausea that doesn't lead to actual vomiting. Others simply find they've lost much of their interest in food altogether. Because a modest reduction in appetite can occur as part of normal aging, it's very tempting to label this as nothing unusual. However, any fresh, persistent shift without an obvious explanation truly warrants attention. When pancreatic function becomes compromised, the digestive process slows down considerably, and pressure within the abdomen can delay the normal emptying of the stomach. Over an extended period, this contributes to malnutrition and continued weight loss, even in cases where meals are not being intentionally skipped. Whenever I hear a patient say something like, "I just don't have any desire to eat anymore," I treat that statement with the seriousness it deserves. I always follow up by asking how long the change has been occurring, exactly when it first started, and whether any other related shifts have appeared alongside it. Unexplained fatigue or a profound sense of weakness represents yet another symptom that is commonly overlooked. While tiredness becomes more frequent among older adults, often linked to changes in sleep patterns, lower activity levels, or existing chronic conditions, there's an important distinction to make between ordinary end-of-day weariness and a deep, unrelenting exhaustion that refuses to improve even after adequate rest. Patients frequently describe this as a heavy, constant drain that makes even routine daily activities feel overwhelmingly difficult. On its own, fatigue seldom points directly to a serious issue, but when it appears together with unintended weight loss, shifts in appetite, or persistent pain, its significance increases dramatically. The body devotes enormous amounts of energy to managing hidden internal problems, and this kind of pervasive tiredness can serve as an early indication that something requires attention. One additional warning sign that remains less widely recognized but carries real importance is the sudden appearance of unexplained blood clots. These may manifest as swelling, redness, warmth, or pain in the leg, commonly affecting the calf or thigh area. In more severe instances, a clot can dislodge and travel to the lungs, triggering symptoms such as shortness of breath, chest pain, dizziness, or a racing heartbeat. Far too many people remain unaware that certain cancers, including pancreatic cancer, can significantly elevate the risk of abnormal clotting, even in the absence of typical triggers like recent surgery, extended periods of immobility, or long-distance travel. In some cases, an unexplained clot becomes the very first clue that prompts deeper medical investigation. While blood clots arise from numerous possible causes, any that appear without a clear reason always justify a thorough check for underlying conditions. The true strength of these warning signs emerges when they appear in combination rather than isolation. A single symptom standing alone might well prove harmless or easily explained. But when multiple signs develop in close proximity to one another, the collective picture grows highly concerning. Appetite suppression paired with unintentional weight loss, bowel habit changes occurring alongside jaundice, persistent fatigue combined with ongoing pain, or newly difficult to manage diabetes appearing together with digestive irregularities, these overlapping patterns deliver a powerful, urgent message. The human body rarely sends only one isolated signal when a serious condition is unfolding. Instead, it typically transmits a series of quiet, interconnected ones. Our responsibility is to recognize how these signals relate to each other. Many older adults hesitate to bring these kinds of changes to their doctor's attention, worried that they'll come across as overly anxious or that their concerns might be brushed off as trivial. Let me offer reassurance. Openly sharing what you've noticed is actually an expression of strength and personal responsibility, never excessive worry. When you report several symptoms together, you provide your physician with essential context that enables more focused and efficient testing. Doctors do not expect patients to arrive with a self-diagnosis. They simply need clear, honest, detailed accounts of observed changes. That kind of open collaboration is exactly how problems are identified earlier. When discussing your symptoms with your doctor, aim to be as specific and concrete as possible. Rather than mentioning one symptom in isolation, paint the complete picture. How long ago did the change in appetite begin? When did you first notice the weight loss? Has the fatigue remained steady, or has it grown progressively worse? Have you observed any differences in your stools? Are your blood sugar levels behaving differently than before? Precise details help steer the selection of tests and determine the appropriate level of urgency. Calm, matter-of-fact descriptions tend to work most effectively. Sharing this kind of information with friends, family members, or others in your circle can create a genuine positive impact. When you empower yourself and those around you, those once quiet signals transform into clear guidance that leads to timely action and brighter, healthier tomorrows. If this discussion has been valuable to you, I invite you to subscribe so you don't miss what's next. In the coming week, I'll be addressing some hidden early warning signs of liver disease specifically in seniors, and I guarantee that at least one of them will catch you by surprise.